The Honourable House Leader for the New Democratic Party.
Thank you, Mr. Speaker. My question is for the Premier. In the spring of 2017, the government announced it had paid $7.5 million for 15 acres of land in Bayers Lake Park for a site of a new outpatient centre. The government paid more than 10 times the assessed value of at that time, Mr. Speaker. Meanwhile, the government already owned the land around the Cobequid Centre, Mr. Speaker. So I'd like to ask the Premier, can the Premier explain why his government thought it was in the public interest to overpay for a piece of private land rather than expanding the Cobequid Health Centre?
The Honourable Premier.
Thank you, Mr. Speaker. First of all, I want to thank the Honourable for the question. The piece of property that we bought in Bayers Lake, Mr. Speaker, is one that would have be completely pad ready, all the services provided, the roads added to it, all of the things that would allow us to start building on it. But to his point, for his constituents, Mr. Speaker, the Cobequid was part of the conversation about when we looked at the redevelopment of delivering health care services in the capital region. The reality of it is, Mr. Speaker, with the population growth that we've seen in and around the Clayton Park and the Timberley prospect, it was deemed that it would be more appropriate, Mr. Speaker, to spread those services out and provide some of those in that particular community where we've seen a tremendous growth in residential communities.
The Honourable House Leader for the New Democratic Party.
Thank you, Mr. Speaker. The interesting thing, some 17 years ago, the former government, Progressive Conservative government, was looking at replacing the Cobequid Centre. They were in the same position. They were looking at trying to move that and buy a piece of land. But they realized if they owned land, it was probably most appropriate to keep as much money as possible delivering frontline health care. The Cobequid Centre was meant to be built onto, upwards, and there's access to the highways all around, Mr. Speaker. It's an amazing facility. I want to ask the Premier, will he ensure that with the $2 billion+ being potentially spent for the redevelopment of the QE2, that the Cobequid Centre has a fair shake and we see improved access to care there as we move forward?
The Honourable Premier.
Thank you, Mr. Speaker. We're very proud of the work that our healthcare providers are doing at the Cobequid Centre, Mr. Speaker, provide services to those of us who live outside of HRM. Mr. Speaker, my family has gone into that particular facility. We continue to enhance that work that is there. Grateful for the community that continues to embrace the Cobequid Centre. When we looked at the overall footprint, though, about delivering health care across the province and this opportunity that we had before us, it was continue to look at what the Cobequid Centre had. How do we look at what's happening in the Dartmouth side and Dartmouth General? At the same time, when we saw traffic patterns and the growth of residential populations, Mr. Speaker, it made more sense that we continue to ensure that the Cobequid Centre will be there for generations to come, and we continue to improve services at that facility. At the same time, we build this primary care outpatients clinic where we see that growth, and the 103 is coming in, and we're seeing a tremendous growth in the people who are moving in Halifax.